Hello, my name's Zoe Marshman, and I'm a Professor of Dental Public Health at the University of Sheffield. In my talk today, I'm going to provide some background to why improving children's oral health is important for early years practitioners, and I'm going to then talk about some practical ways we can work together to improve it. When we talk about oral health, what we're really talking about is tooth decay. Tooth decay remains very common in young children. Around 1/3 of children have tooth decay, and that's from the latest survey of 5-year-old children. And on average, those children who have tooth decay have 3 or 4 teeth affected. But like many other diseases, the distribution of the disease is not equal in the population. So children living in deprived areas are 3 or 4 times more likely to have tooth decay than those living in the least deprived areas. And there are also some differences between different ethnic groups. So while the photo on the screen shows the teeth of a child with tooth decay, and the child is smiling, we do know that tooth decay can have a big impact on the daily lives of children in terms of pain, infection, having to take time off nursery or school, and for parents taking time off work as well. But there are also some less obvious impacts in terms of feeling self-conscious. The management of tooth decay can be difficult for children. And as we know, dental fear and anxiety is very common too. For young children, if they're having 3 or 4 decayed teeth out, they will often need to go to sleep, to go to hospital, to have a general anaesthetic. And that can be really difficult for children and families and very costly for the NHS. This infographic shows the dental extractions for children in the northwest of England and shows some of the impacts on children, families, and on education. So it's important to stress with families that baby teeth do matter. They matter because they help children eat and speak. They help prevent the negative consequences of pain and infection. They shape our face and our smiles. And looking after teeth is an important daily healthy behaviour and an important skill for life. And the priority that's now placed on oral health is recognised through government documents from the Department for Education and for Health, covering early years and also for nurseries, for schools, for childminders, but also into primary and secondary schools. So let's move on now to the causes of tooth decay and how we can prevent it. So what causes tooth decay? Well, it's caused by the destruction of tooth tissue due to acid that's made by bacteria in plaque. Plaque is the sticky stuff that constantly forms on our teeth, and every time people have sugary foods or drinks, the bacteria in the plaque produce the acid, and that attacks the tooth and can start with maybe just a small white patch, but then can progress through the layers of the tooth, right through from the outer layers, right through to the inner layers of the tooth and the pulp, and that's when the tooth can die. And in terms of prevention of tooth decay, there are 3 main ways of doing that: through reducing the amount and frequency of sugar consumed, through strengthening teeth with fluoride, and through visiting the dentist. So I'm going to talk through each of these 3 ways in turn. So starting with reducing sugar consumption. Sugar, as we know, is also a key risk factor for conditions like obesity and diabetes. And when we think about sugar, we maybe think of the sort of loose sugar, the table sugar, like the image on the left. But also there's a lot of hidden sugar in foods and drinks that are very frequently consumed by children. Things like cereal bars, yogurts, so-called fruit bars. And one of the things that is particularly important is the timing of when those food and drinks are consumed. Particularly important to avoid sugar-containing foods and drinks, particularly at bedtime. But we do know for young children that they often do eat little and often, and snacks are often quite a key source of sugar for them. And again, important to recognize that even natural looking foods with, say, honey, or perhaps things like fruit smoothies or dried fruit, still contain the type of sugar that is damaging for teeth. So those so-called kind of healthy looking natural foods and drinks can catch us all out. So it's really important to look at the labeling, because that can help us to look at how much sugar and what types of sugar are in those foods, but also in drinks. So if we think about drinks, we know that the tooth-friendly drinks are really only milk and water. And it's not just the drinks themselves, but also the vessels where children learn to drink from. So we recommend that although bottles may feel from some parents to be a little bit more practical and less messy, they do tend to encourage children to suck over long periods of time. So we do recommend free flowing cups from 6 months of age, and discouraging bottle feeding from 12 months. So moving on now to fluoride. The most common type of fluoride that's available daily for children is from toothpaste. So if we're thinking about toothpaste with toothbrushing at home, the fluoride works by strengthening the outer enamel, making it more resistant to acid, and it actually also kills the bacteria as well. So if we think about toothbrushing, we know that teeth should be brushed as soon as they erupt, so the fluoride can have that strengthening effect, and they should be brushed twice a day. You should use a small toothbrush with small bristles, soft bristles, and you'll see on the slide the correct amount of toothpaste based on the age of the child, with just a smear of a family toothpaste for younger children and a pea-sized amount once they reach 3 years and above. So for families, they're all fine to use the same tube of toothpaste for the family, looking for fluoride around 1350 to 1500 parts per million of fluoride. And again, just as we avoid sugar before bedtime, it's actually really good to brush your teeth last thing at night with the fluoride toothpaste, because the amount of saliva we have at night dries up, and so we really need the fluoride to protecting teeth while we sleep. So for home toothbrushing, we recommend children just to spit out after brushing, and that parents should supervise children under 7 years of age. And the reason that supervision is important is because, well, there's several reasons. We know that that's not without challenges, and that parents do describe difficulties with toothbrushing with children. We know that babies and toddlers often don't like having their teeth brushed, and that sometimes parents do give up because they're wanting to avoid the meltdowns and the tantrums. We know that it's sometimes not a top priority for families, but we would really encourage parents to keep up with that supervision of toothbrushing, because it really does help, because they can make sure that the child is actually brushing their teeth, that they're using the right amount of toothpaste, that they're brushing last thing at night, and they're brushing twice a day, and that they're actually brushing their back teeth and not just the teeth at the front that they can see. So it is difficult for parents, but it's really important that parents are encouraged to actually supervise and keep going with that supervision. And in some areas of the country, to complement home toothbrushing, nurseries and schools run supervised toothbrushing programs. So these are mainly in early years settings, children aged 3 to 6 years, and they're funded by local authorities or the NHS, particularly in deprived areas. So I'd really encourage early year practitioners to get involved in these programs, and all the training and resources that you need are available for those programs that are run. And there's, in addition to that, there's a national research program called Brush. You can see on the screen the link to the online toolkit, where again, lots of tips and resources for nurseries and schools and childminders about how to support supervised toothbrushing as a key way of complementing home toothbrushing in young children. So the third way to prevent tooth decay I'm going to mention is about visiting the dentist. So the visit to the dentist for children is really important, so they can check the children's teeth and mouth are developing. They can provide advice and support to parents. And they can also apply fluoride varnish. So fluoride varnish, again, another source of fluoride, really strong and effective, applied by different members of the dental team. And that can be applied regularly, and would definitely encourage parents to ask for it when they go to the dentist, because it's a very quick and easy way of preventing tooth decay, which can be particularly good for children at risk of caries due to their diet or other social or medical reasons. So parents should take their child to the dentist by the age of 1, and the website on the screen allows parents to put in their postcode and find a local dentist. And although we know that finding a dentist can be difficult, in many local areas now, schemes exist to try and encourage dental practices to prioritise seeing and treating young children. But I'd just like to finish with a summary of what early years practitioners can do practically in their roles to promote children's oral health. So they can reduce sugar consumption through healthy eating sessions with children and parents. They can promote toothbrushing through running supervised toothbrushing programs, and also promoting home toothbrushing, and while acknowledging that it can be difficult for parents, and providing some practical advice to help them overcome this. But also encouraging children and parents to visit the dentist, making it a positive experience, perhaps using stories or role play, or even inviting a member of a local dental team to come and visit, or running an event as part of a National Smile Month. So I'd just like to finish to show a useful link to a website where lots of resources and further advice on the topic that I've covered today can be found. Thank you for listening.